Welcome to SPRC's Prevention and Practice Success Stories. I'm Zoe Baptista. Today I'm speaking with Heather Spada, the Suicide Prevention System Manager at United Way of Connecticut. Heather's been working with her state's Garrett Lee Smith team to develop and implement an Upstream suicide prevention curriculum to help elementary schools discuss mental health with children. Hi, Heather.
Hi, Zoe.
So let's start at the beginning. What prompted your state to address children's mental health?
As we were planning for the Garrett Lee Smith Youth Suicide Prevention Grant, we started looking a little bit more closely at the 2017 school health survey that was given to 9th to 12th graders. And two data points stood out to us in particular. 1 in 3 of the high school students who were interviewed in this study reported that they could not even identify one teacher or another adult in their school to talk to if they had a problem. And that really sat very heavy with us. The other piece is that almost 25% of these students said that when they feel sad or empty, hopeless, angry, those types of emotions, they cannot get the help that they need. So in looking at that, we felt that those two statistics in particular could be more easily addressed in the elementary school. So what we did is created a 38-page book in order to educate children themselves about their mental health, to teach children when they're in elementary school. Then hopefully when they get to high school, they're going to have some of these skills in place already, so they can build their mental health.
Can you tell us more about that book featuring Gizmo, the therapy dog, that helped you address upstream children's mental health?
Absolutely. So Gizmo is our state suicide prevention mascot, and he is a pet therapy and a canine first responder dog. So he and his friends are included in this book, and it goes through different pieces talking about what is mental health, what are some activities that I could do, speaking as a child can do, in order to understand what mental health is and to care for myself, to help make my mental health as strong as possible. And how can I understand what a trusted adult is? And how can I connect with a trusted adult, whether it's at school or at home or in my personal life?
How did you work with schools to develop the mental health curriculum that goes with the book?
As the books were being sent out and people were utilizing them in their different areas, they were sending us feedback. The majority of the individuals that gave us feedback were working in the schools. They were also sending us ideas that they utilized and made up themselves of how they produced activities to go along with the different areas of the book. We asked them if we could meet with them and talk with them and more formally record what they were doing. And with that, we created a very easy to implement curriculum in order to emphasize every segment of the book with specific activities for the children to do and also for the adults to do with the children.
So it's my understanding that currently there are about 20 schools in Connecticut implementing the pilot curriculum. Is that right?
Correct. We have 20 schools in Connecticut that are implementing the Gizmo curriculum, which utilizes the book and then other activities.
Can you tell us about any challenges and how they were overcome? For instance, how did you get school staff on board with this new curriculum?
With the school staff, trying to bridge the gap between discussing mental health and then education, sometimes there's a gap between the terminology and just having a common understanding. And so one piece that we required of all the pilot sites is that all the school system staff had to engage in a gatekeeper training. And what that did was that helped to, one, give the common terminology about mental health, about prevention, about connecting children to services, and about just being able to listen and to attend when someone is in distress. It also really helped to solidify and reinforce that every adult can do something in connecting with the child. You don't have to have your master's degree in counseling or in social work. As they say, the no wrong door, that whoever the child goes to talk to is the right person. It also reinforced that the whole school system itself was on the same page and that they were one team coming together to really help to elevate growing in mental health.
That was fascinating, Heather. Thank you so much for sharing your story about developing and implementing an upstream suicide prevention curriculum for elementary schools in Connecticut. Thank you for listening. For more information about suicide prevention, visit us online at sprc.org.